Save lives and bring hope to those affected by suicide. That is what the American Foundation for Suicide Prevention is all about. They were established in 1987. They are a voluntary health organization that gives those affected by suicide a nationwide community empowered by research, education, and advocacy to take action against this leading cause of death. It's led by a CEO. It's headquartered in New York. They have a public policy office in Washington, D.C. AFSP has local chapters in 50 states with programs and events nationwide. AFSP celebrates 30 years of service to the suicide prevention movement. And also, AFSP is made In 1987, a small group of caring individuals had a vision to establish a private source of support for suicide research and education, and essential suicide prevention efforts could be sustained into the future. These founding families, each one of whom had lost someone to suicide, joined with scientists to create what today is the American Foundation for Suicide Prevention, or AFSP. Many of the original founders were concerned about an alarming rise in youth suicide over the previous 4 decades. During this period, the suicide of young men had tripled, while for young women it had doubled. Suicide is currently the third leading cause of death among young people aged 15 to 24. The highest overall rates of suicide are for adults aged 40 to 59. Before AFSP, there was no national scope non-for-profit organization dedicated to understanding and preventing suicide through research, education, and advocacy. AFSP is dedicated to saving lives and bringing hope to those affected by suicide. AFSP creates a culture that's smart about mental health by engaging in the following core strategies. Number 1, they fund scientific research. Number 2, they educate the public about mental health and suicide prevention. Number 3, they advocate for public policies in mental health and suicide prevention. Number 4, they support survivors of suicide loss and those affected by suicide. And that is their mission. AFSP is mainly funded by donations given. An example would be funding from individual donors, including the thousands of highly motivated individuals who participate in the Out of the Darkness walks. Their walks raise AFSP has a place for everyone. They have local chapters in all 50 states. AFSP's chapters are at the forefront of suicide prevention. They engage with families, mental health professionals, community and local business leaders, school administrators, and others interested in preventing suicide. There's education programs available. AFSP was founded on research, and they developed evidence-based programs using the latest science on suicide prevention. Some of the programs they have include training in mental health and suicide prevention for schools, communities, workplaces, and how to prevent suicide. Can also be an advocate. Advocates can help pass policies that will save lives, suicide prevention for schools, training for clinicians, funding for mental health programs. Advocates make suicide prevention a priority. Their public policy team gives volunteers the tools they need to advocate for suicide prevention at both the state and federal levels. There's also suicide prevention research. They are the largest private funder of suicide prevention research. They're dedicated to finding the best ways to prevent suicide, and thanks to donors, they have been able to fund millions in research across multiple scientific disciplines. Much of what we know about suicide comes from their studies, as they open up new areas of inquiry, and Council of Scientific Advisors helps set the national research agenda. They also have Out of the Darkness walks and events that you can get involved with. The mission behind why they walk: every year, suicide claims more lives than war, murder, and natural disasters combined. But yet, suicide prevention doesn't get anywhere near the funding to other leading causes of death. It's up to walkers to make a difference. So together, we can change the conversation about mental health and put a stop to the tragic loss of life. If an individual has lost someone, there is a lot of great resources that they can turn to. Many of the donors and volunteers, of whom are lost survivors themselves, can provide resources to help heal. AFSP's goal and mission is to reach out. So they have local programs in all 50 states. AFSP engages with families, mental health professionals, community and local business leaders, school administrators, and others interested in preventing suicide. Their mission is to save lives and bring hope to those affected by suicide. Since its founding in 1987, AFSP has had many successes. They mobilized and connected tens of thousands of people who have lost a family member, loved one, or friend to suicide. They reached thousands of individuals who are at risk for suicide, as well as those who love and care for them. They attracted the participation of members of the scientific and clinical communities who conduct groundbreaking research on suicide and its prevention with support from AFSP. They established local chapters in all 50 states. They educate hundreds of local communities about suicide and how to prevent it. They created a public policy and lobbying arm by merging successfully with an existing national policy organization, thus enabling AFSP to press for legislation and policies at the federal, state, and local levels that advance the goal of preventing suicide. They substantially increased their funding from individual donors, including the thousands of highly motivated individuals who participate in their Out of the Darkness walks. They educated reporters and media about how to best cover suicide. And lastly, they communicated with hundreds of thousands of individuals through the website, social media, brochures, speakers, and efforts to generate press coverage.